So today I've got the privilege of talking with Jenn Maley over at Mediorbis. Mediorbis is a fairly new idea to me in the telehealth space. And traditionally, telehealth has been a real struggle for companies and for guys like me, advisors and consultants, in finding the solution that actually works. The fact of the matter is that although the digital age has been around for a while, there's certain things that people have been a little bit slower to adopt, and telehealth is one of those things. Now, with the COVID pandemic, we really saw an uptick in some of these things, but it's starting to fall off now a little bit more than ever. But the fact is that telehealth can be a huge asset to your health plan and a huge asset to your employees. So that's why I brought on Jenn to the podcast today. Want to walk through, who Jenn is, what Mediorbis is, and learn more about their product so that you can understand the differences in telehealth and get a better idea on what you can do to make your telehealth plan as successful as possible. So with that being said, Jenn Maley, you've been with Mediorbis a little bit over a year, but that's not any fun. Tell us a little bit more about who you actually are.
Well, that's a lot of layers, but really, I'm really passionate about helping people. Look, I'm just a simple kid that grew up on a farm in the middle of nowhere, Illinois. I was raised a little bit different, and I had my first experience with healthcare when I was 16. My dad had a massive heart attack when we were shelling corn. So it was kind of scary. Luckily, my mom was a critical care nurse, so she was the nurse my whole life, and I called her. But really, I've just always had a passion to help people. I just want to do something to make their life a little bit easier. I try to do that every day, whether you choose my telehealth or you work, with somebody else. That's okay. I'm still going to tell you the tools and the things that you need to look for when you choose someone in this space. And really, I started out in RBP, and then I moved over to engagement because really, if you don't have any engagement, then you have nothing. And then I went to telehealth because it's really kind of starting to come full circle for me. And I just really have a passion to help smaller health plans, right? Don't tell my boss that he wants the big ones. Just kidding. But anyway, I just want to put something in their hands that they can afford that gets them access to top tier people whenever they need them. So that kind of rolls everything all together. And if I can partner with people who really see what we're missing, what we're lacking in healthcare, although I can't fix it, I can be part of the change and I can be part of something a little bit bigger and helping people. It's not that hard, right? This is not that hard. But in this industry, historically, we have not educated people. Um, a lot of people don't even know how telehealth rates are calculated. Therefore, they don't understand how to make the engagement work. And if they do get engagement, they don't understand how to choose the right vendor for them. So really, I just want to educate people as much as I can, give them top tier access, and whether that be with me or someone else, that's okay. But if we can educate not only the end user, but also the HR professional and the consultants out there, and that's our job as a vendor. We need to be held accountable for that as well.
No, absolutely. And you and I have gotten to know each other a little bit through our working together, learning more about Mediorbis. But there's one really interesting thing that I know about your family, and that's the fact that, after the heart attack and everything else, your dad developed quite the sense of humor. So if you wouldn't mind, I'd love to hear one of the infamous dad jokes that you've been blessed with.
Absolutely. I mean, there are so many. Hopefully his humor has trickled down to me a little bit. But so over the weekend at dinner, we were chatting and he said to me, "Hey, do you know why a chicken coop has two doors?" So do you know
No.
why a chicken coop? No, because if it had four, it'd be a sedan. And we laughed until we cried with that one. Uh, and then another favorite of his is, if you were driving down the highway at light speed and you turned your headlights on, would anything happen? I said no.
Well, I'm with you in the camp of no. I think we need to bring in Elon Musk. He's the expert on traveling at extreme speeds with rockets and things. So no, and that's a good part. But on a more serious note, you mentioned earlier that your mom was a critical care nurse. Um, but tell me this, from your experience at 16, even though your mom had experience in the medical field, how easy was it to navigate the healthcare system and really make sure that he was getting the care he needed when he needed it?
Boy, it was hard. It was really hard. My mom mentioned several times that she felt like an idiot. Um, and I saw my dad cry a couple times, right? Because they're getting hundreds of thousands of dollars worth of medical bills. And I mean, I don't come from a small family. Like I said, I'm a simple farm kid. Well, there were five of us, and I'm the youngest. Um, so when I was 16, everybody else was grown and gone. But they were, you know, in the mix between being married and in college and all of these things, and then they still had me at home, and they've got hundreds of thousands of dollars worth of medical bills. And you know, it's funny that you would ask that question because, you know, now 30 years down the road, well, not quite that long, but 25 years down the road, my dad was diagnosed with CIDP, which is a really rare immune disease, and it affects the myoclon in your spinal fluid. So he was really struggling walking. These infusions that my mom, by the way, is qualified to give. I should just throw that out there. She is qualified to give infusions at home, but his insurance company will not allow that. So instead, they're paying $10,000 a month for this gamma globulin infusion treatment, which, as we know, is a byproduct of blood, right? So I watched a man work on this farm his whole life. Like, I mean, my dad's a pretty awesome guy, right? I harvested with him. I drove the auger wagon. That's another talent. I can unload on the go. So just saying. But now he's struggling, determining, does he still take this treatment? Because I mean, you know, they're older. Do they pay $10,000 a month, or do they just do what they do and see how bad it gets? Like it's a gambling game. So you know, this last experience that he had in the hospital, they had a lot of doctor bills come through, and they didn't know what they should do. And I said, well, what we're not going to do is pay any of them, because as soon as you start to pay them, you don't even have an EOB. We can't match these up, right? We need to ask questions like, why are they not approving you to give these infusions at home when it would only cost $2,500 a month? I should throw out there $2,500 a month to do the infusion at home, but they won't do that. Why are you getting bills and they're threatening to send you to collection? It's been 2 weeks and they're refusing to give you a statement. All of these things. So healthcare has not gotten any easier to navigate. It's harder. You know, now my parents have another 25 years of experience in this game, and they're not that healthy. I'll be honest with you. My mom had a stroke not that long ago. She's not the same. So these things are going to become more prevalent. It's going to happen more often, and they don't understand how to navigate anything. So, you know, what do you do in that situation? You learn as much as you can about every aspect of this industry so that you can educate your own parents, and then hope that you can change something for the better. And that's really why I do this. That's the only reason. I feel better at the end of the day.
No, absolutely. And that's, you know, I think a super valid point is, again, we're talking about, you know, somebody that was a critical access nurse, um, had experience in the medical system, and 25 years ago was struggling with it. You know, now they have at least one child that is in the healthcare industry. They've been doing this for a while, and it's still tough to navigate, and arguably it's even gotten tougher. And one of the stories I like to bring up is a gentleman who told me that when he was diagnosed as a diabetic, that the office visit that he got diagnosed at was so short and abrupt that he actually had to learn how to inject his own insulin via YouTube, which is absolutely crazy. And I think that turns us into a good point of talking about Mediorbis. I think we need to start with, why is there such thing as Mediorbis? Walk into what you're doing differently, and to help show people how something like Mediorbis can help create that engagement. It can help be that VIP experience for their employees by having somebody that is an expert in navigating the system, helping them, and just really delving into it and learning more about, you know, the why behind Mediorbis.
Absolutely. So, you know, I have a really awesome team and I have a really amazing CMO and co-founder in Dr. Weeson. And probably the main reason I came to work for Mediorbis and this all came to fruition. He has a passion for being able to treat a patient the way that they need to be treated, not the way that the healthcare system tells him that he has to treat them. So when he decided he wanted to do something different, everything was going on, and he thought, we can do this better. Like, why can't I prescribe this medication instead of this medication when I know this one's going to work? So that was when he determined that the best way to do this was to create a large physician network, which is where we started in my specialist MD, of private physicians that really just wanted to shift the paradigm in telehealth, right? We wanted to come to market with some sort of differentiated product that would get top tier physicians in front of any patient at any time to help them with anything. So we don't treat just acute uh, episodic episodes, right? We can treat over 10,000 CPT codes. We have a full extensive health risk management program, and ours is differentiated, right? So you're meeting with your support team. We have educational information and wellness information that we pass on to those members, the sickest members. So we do this across the population with AI. We can look at your data. We can tell you, listen, you've got a sick population. We need to put health risk management in there. You're going to have access to those top tier physicians, the top in their specialty. It's not just a general physician. You're going to get someone who specializes in endocrinology or internal medicine, whatever you happen to need, right? So they're going to have that personalized physician experience. But then we decided that wasn't enough either. So, you may go see a doctor and not really like their bedside manner. For me, it doesn't take a lot. You need to know who I am, and I'm pretty in tune with what's going on with me. Not everyone is that way. But I'm very cognizant if I have any sort of change, even if my blood pressure changes. So I don't really need the back and forth. I'm going to come in, tell you what's wrong. I need to do what I need to do, and let's go. Right? Other people, it's all about that relationship. So we came to market and we allow you to choose your physician. You get to choose from any number of licensed physicians within your area, within the specialty, if we're talking about chronic disease, right? That can help you. And you can schedule appointments. You can do that in advance, up to a couple months out. So you can establish that one-to-one relationship. It is really no different. And, we wrap mental and behavioral health coaching around that. And it's because in order to get the engagement, in order to get people to participate, especially when we're asking them to change lifelong behaviors, if you bring some 50-year-old lady in that's smoked 2 packs of cigarettes for the last 35 years and she's never had an issue until today, it's going to be really hard to get her to stop smoking. But if we can sprinkle in a little bit of help to help modify the behavior and help, ease them along that, there's a lot of mental health that comes into quitting smoking or losing weight, because so many times it's emotionally based, right? The busier you get, you want a cigarette. Or if you get sad, you want to eat. That's me. That's my problem. I'm an emotional eater, and I do not need any reason to make a poor food choice. I mean, I will order Taco Bell every time I come home from any kind of business travel. Go to Taco Bell every single time, to the extent that the girls usually say, did you just get back from a trip? So that's a habit, right? Even though we don't think that that's a huge bad habit. I mean, what am I eating? I have no idea what I'm eating, but it tastes really good, so I'm going to eat it. We need to change those little bitty behaviors in order to make someone successful. And that's what makes Mediorbis different. We will hold your hand the whole way through. We're going to tell you exactly what's happening. All of the members that come through our program have access to any kind of support that they may need 24/7, 365. If they travel to Mexico, they have support. I needed support when I was in Cabo not that long ago. That's a whole nother story, but I was able to get that. I had a great team. So we're just there to be able to address anything that comes up at any time. And for those more long-term types of goals and diseases such as diabetes, as you mentioned earlier, we can work on those on a month-to-month basis and get them through that so we can actually see that diabetes remission. We're averaging 15 pounds of weight loss a month in our program. So it's really just a great program. And I think our results are speaking for the way that we're approaching this.
No, absolutely. Now, not to vilify any other telehealth vendors, because there's a lot of really good players out there that have a good heart and are trying to do good things. But would it be fair to assess that the standard that you see embedded into an employer-sponsored health plan tends to just be that acute or single episode type treatment?
Yeah, or I do see some that have like your general telehealth, and then your full EAP and maybe diabetes management. They're not encompassing all of the chronic diseases in one program at a cost-effective rate. I don't really even know what the cost is, but we're trying to do this across the population cost effectively and scalable. So as our employer groups grow, as our consultants population grow, we're able to scale that out and offer a top tier product across the board, whether you have 50 lives or 5,000 lives.
No, absolutely. So another question when it comes to how Mediorbis is a little bit differently, there's always a jumping off point. There's always somewhere where the amount of care that can be given in a virtual setting has to end, and we really need to get somebody in front of somebody. So two questions there, Jenn. First, can you kind of explain how, because you've intentionally designed your product to be extremely robust, to be able to cover a lot of facets, how we can delay before we need to jump off, but when that jump off point comes, what resources do you have on the backside to not only help members, but to also make sure that as an employer, people are getting cost effective and quality care?
Right. So we have the capability to bring in the plan documents, right? And we agree with you. There are certain instances where someone needs to be seen in person. We can only do so much within a virtual setting. We have strategic partnerships all across the United States. We can help direct your members within the plan, of course, because you as the consultant, you know what's good for your plan. You're going to tell me within those plan documents where they should go. And that's how we're going to navigate them, right? If they need support to go in person somewhere, we're going to say, 5 miles from your house or whatever, if you can get to this particular ABC diagnostic center, you can get your MRI there, or you can get your blood work there. We will reach out, right? We do all of this electronically. So we're going to send the orders. It's going to be no different than if they were in person at a physician's office. But there are times, yes, when we have to send them to a facility, boots on the ground. But we're always going to navigate them based on what you've told us to do, right?
No, absolutely. Thinking about an employer, because there's employers listening to this today, and like I started the podcast, telehealth has kind of been one of those things that's been promoted and it's so great, but employers just they haven't seen the ROI. They're spending $3, $4, $5 a month per employee to have this, but it's questionable on how much ROI it's done. So again, I've got multiple questions on here, but I think the place to start is, what are some of the things that you are doing as a company to help quantify this investment by an employer and really show them that this is not just a fun little tool you have in your plan, but it's a tool that's actually making an impact both on the health of your employees, but also on your bottom line.
Of course. So we have what we like to call an open platform, right? I can tell you the ROI is whatever I want to tell you. And sometimes you have data that backs that up. But we've found the best way for you to see those tangible, quantifiable results is to just give you access real time into what's going on around HIPAA compliance, of course. But you have the capability of actually saying, listen, I've got a 50 life group, and not one person has used it, and I'm not seeing where any emails have went out, right? Because we do engagement. We reach out to your members. We welcome them to Mediorbis. We can send out push notifications through the app, all of those things. So we're going to give you a bird's eye view. You get right in there. You can see how long people are waiting, what times they're coming in. You can even look and see what prescriptions have been prescribed. So whatever you need to see, that's especially helpful if you have some contracts in place or whatnot, or any kind of specialty drugs that we may be seeing, which we will, by the way. If you have a specialty pharmacy or specialty carve out, we'll bring that formulary list in and we will embed that in the back end. So we like to call every group a custom group. And the reason is each one of them have access to their own portal. So you as the consultant can come in, you can pull a report at 3 a.m. And if you have a group that says, you know, Nick, I don't need telehealth. Our population's fine. Nobody's ever used the telehealth. If you can get your hands on data, which I know sometimes is hard, we will do the analysis and we will tell you every code that we could have treated. Now you have quantifiable, tangible numbers where you can go back to your employer group and say, listen, this is why we need telehealth, because Mediorbis could have treated every single one of these codes. So we need to get in front of this. And if we had done that, you would have saved X number of dollars. Usually it's substantial.
Absolutely. And it's probably long overdue that I bring this up. I mentioned that Mediorbis tends to be one of the most competitive in the marketplace. But again, a lot of times we're seeing that price point for a group on Mediorbis to be about $3 per employee per month. I can tell you that there's a lot of telehealth vendors that are at $4 and $5. So Mediorbis is less expensive. It's more robust, and by doing that analysis, you can really determine. And I guess my challenge to you as an employer is if you have that data and you can see that, hey, we could have decreased the amount of visits by 15% if we would have had Mediorbis. That is an awesome metric to be tracking. Jen can give you all those reports to show you, but really working as a team. Unfortunately, employee benefits is like its own business these days, and we have to run it like a business. So, educating your team on the telehealth, being able to get them in front of people in a virtual setting is going to save your plan big dollars. And another thing that's long overdue to talk about, Jen, is, if I recall, it's super expensive for the employee to go get services via Mediorbis, correct?
Okay, say that again. I'm sorry.
There's a really big copay if an employee wants to use Mediorbis. It's like $100. Oh, it's zero.
It's zero. For some of our really small groups, I do have one group that only has 3 members. They wanted a $10 copay to help, cover that cost. So we did do that, but no, our pricing is a $0 copay. You need to specifically request us put a copay in there, and every group is different, right? So not shaming my 3 life group. I love you. You know who you are. Great group. It just worked better for them to have the copay in place.
No, and I think that's super valuable. But I think the point that I want to extract out of that is that the standard model is that Mediorbis is 100% free to the members. So when
100%.
we're talking about today's economy and everything else, I'm a blue collar guy. I love my blue collar industries. And we're talking about people that are making $30,000, $40,000, $50,000 a year. And by all standards, they're doing well. I've got employers that really care about their people. but these people don't have a lot of money left over at the end of the month. And so having a way that they can go get unlimited access to the healthcare that they need without fear of financial burden is awesome. Obviously, again, you as an employer can throw in a copay if you need to help offset some costs, but the standard is to run with no copay at all, make it more affordable for your people. Jenn, as I'm sitting here thinking about other things that employers have to think about, yeah, we're in a tight economy as far as the financials go, but we're also in a historically low unemployment rate. And being here based in Nebraska, that's one of the lists that we hit the top of over and over and over, is that we have very few people on the unemployment rolls. So employers have to get creative, and they have to think, how can I attract and retain the right staff members? So my question to you is specifically around Gen Z. They are starting to really flood into the employer market. They're graduating college, they're graduating high school and entering. What are you seeing from Gen Z as far as their acceptance of telehealth, and how can employers position the fact that they have a robust telehealth like Mediorbis embedded to help attract and retain those young members of the workforce?
Well, I'm going to be honest with you. I have one of those that's graduating college in May. And he told me that, and I will be honest, he has a bad heart. So he does have a heart condition, and he does have to see a cardiologist about once a year just to make sure. However, he said that he would get annual checkups and do blood work and listen to the physician if he had any lifestyle changes he needed to make, if he could do it all virtually. So he's adopted it. My other son is a Marine vet. As you know, I'm a huge mental health advocate. He struggles with mental and behavioral health. I will be honest with you, I do not think that he would have reached out for any help initially. And he is an honorably decorated Marine vet, so he does have TRICARE, but it's very hard to navigate. So I don't think he would have gotten the help if it wasn't virtual. And he told me it was because he was embarrassed, right? I mean, he's a Marine. He's a decorated Marine, and he felt like, that made him weak, and Marines aren't weak. So I'm especially thankful for that virtual health. So I've got two, a millennial and a Gen Zer, and they've both adopted it. I would tell employer groups that if you can put a specialist in the pocket of your employee 24/7, even when they go on vacation, because as we know, that generation travels, they like to go out and see things. So even when they're on vacation, no matter where they're at, that's a benefit that you can roll out from day one, and they don't have to do anything. We'll do everything for them. We've removed the lift from the member completely. They don't even have to set up their own profile. So these are things that are attractive to folks. They can get their prescriptions that way, and they can do it also via text. We are compliant and secure. So unless it's something that we need to be on video for, we can actually do it via chat. They don't even have to go on video with the physician if it's something general. That's attractive. And that it costs them nothing, that's even more attractive. And then you sprinkle the mental and behavioral health in there. And although they're probably not going to stay a lot at first, it's something that we're seeing a lot of use. The engagement on that coaching side is very, very high. And it's because right now, I mean, it's Christmas time, right? And it's stressful. So having that outlet for your employees is huge. And, and plus you get me. I will do employee health benefit fairs, open enrollment meetings via webinar, however you need me to do it. And I will educate your employees on how to use the app. I'll show them, and then I'll incentivize them to download it and use it.
No, absolutely. And I think that's a good pivot into kind of wrapping up our conversation around Mediorbis. And Jenn, that's somebody listening to this says, I love what Jenn has to say. I love the platform. We jump on, we do a demo for them, dig them in a little deeper. But the next question is deployment. How do we make a successful deployment? How do we get employees excited about this benefit?
We make it simple. So, right, and I'm going to be honest, as the vendor, I am going to rely on HR and you as the consultant. If you were the consultant for that group, I need you to communicate and let them know you have telehealth. This is who the telehealth is. So that way, when I start engaging with these members and sending them information in their welcome email, they know, yeah, this is trusted. Because as you know, it's very hard to get buy-in. It's very hard to get trust because there's a scam going on every day. So I need your help from that side. But then we also give you all kinds of cool member facing materials, right? That you can do via email, payroll stuffers. We can send push notifications. You get a custom QR code that you can post in your break room or send out via email, and they can just scan it if they want to be mobile only. We do all of those things to just try to ease them into it a little bit, a little bit more successfully.
No, I love that. And I'll tell the audience that when it comes to telehealth, I've historically been a bit of a doubter. I just have not seen a good deployment of it. And I've not seen a telehealth option that really, I guess, meets the mark of my expectations. And when I got introduced to Mediorbis and got to know Jenn better and know Mediorbis better, I was really blown away. And I think one of the things that I want to kind of take out of what Jenn has said today is the fact that they can get, things like the PBM, the formulary contract, and they can make sure that their physicians are prescribing off that to make sure that your people are only getting prescribed medications that they can access through their pharmacy plan. But it's all parts of it. And historically, telehealth has been a bolt-on. It has not been an embedding. And that's where Mediorbis is really different, is that they want to embed in your health plan. They want to be a part of it, not just an accessory. And that's what truly makes them unique. So definitely, if you're wanting to learn more about Mediorbis, make sure you reach out to me. You can also reach out to Jenn through places like LinkedIn. It's Jenn Maley, or mediorbis.com. But we're going to keep going here for a little bit longer. Jenn, you're not off the hook yet. As far as the healthcare industry goes, I have a couple of bonus questions for you. Obviously, at 16 is when you first kind of really got your glimpse into what I would call the ecosystem, health insurance, healthcare, and that's been a big part of your life ever since, through multiple different roles. How has healthcare evolved from where you first encountered it?
I hope you're not talking about the BUCA side, because I'm going to say it hasn't. It's gotten worse. On the self-funded side, I am seeing a lot more consultants and health plans embracing innovation. At the end of the day, it's all about data and innovation and analytics and working together, right? There are so many employer groups out here that need help. There are so many. My parents just closed one of their companies because they can't afford health insurance premiums anymore, right? They just can't. They cannot do it. It's way too expensive. We need to work together. And I also feel, like you said, that's what makes Mediorbis a little bit different as well. It's a true partnership mentality, right? Not one person out here can change and continue to innovate, but if we all kind of band together and listen, it's not going to be the same people in the same sandbox every time. But as long as we keep that open and we're all willing to work together to bring a little bit together for that piece of the pie and share that data amongst each other, and do what's right by the employer group and the member, then at the end of the day, we all did our jobs and we've made it a little bit better for the next guy. And that's all I'm looking to do. So if we can create just a little bit of change and continue on this forward path of innovation and using the data and technology and innovation that we're seeing in our plans, to effectively communicate and to get good care in people's hands, if we educate them about it, they're going to use it, and we're going to see costs come down a little bit.
No,
Hopefully a lot.
absolutely. Yeah, a lot would help everybody. And then the final bonus question for you, Jenn, if there was one mark that you could make on what I call the healthcare ecosystem, what's that mark that you would love to make? Is it, you talked about your dad and some of the high cost treatments that he has to go through. I know you're passionate about mental health. You've had some experience in mental health and dealing with your son. What is one thing that if this could be what Jenn Maley gave the world from a healthcare ecosystem perspective, what's the one thing that you hope you can accomplish before you're done?
Well, that's a loaded question because there are so many things that I want to accomplish, to be honest with you. But I am going to go with the mental health. Listen, I've been through some stuff. I have a PTSD diagnosis. People need to understand that just saying that it's okay to seek mental health but not embracing it, is not helping. We have a whole population of men who are scared to reach out. My dad was one of them. And I'm going to be honest with you. If my dad says it's so, it's so. I don't need to look anywhere, no encyclopedia. If he says that's how it works, and that's how it works, because he's a pretty cool guy. Smartest man I've ever known. If we can, create an atmosphere to where mental health advocacy is celebrated for everyone, or I don't know what the answer is, right? But if I can just make it a little bit easier to understand that it's okay to not be okay, and it's okay to not be normal all the time, then I'll be okay with that. I just, everybody is enough just as they are. So that mental and behavioral health piece is probably the biggest one for me, because it just rolls into so many things. So many things: stress, your success at work, your success in your personal life. All of those things are tied to our mental health. And the sooner we create a normal, level playing field for everyone, the better it's going to get. And I don't know if you know this, but I mean, the percentage, the increase, and I would have to look it up, but it's somewhere like 60 some percent. It's an obscene number of men between the ages of 38 and 45 have admitted that they need mental health treatment and are not seeking it.
Mm-hmm.
So I would say that's the one thing. If I can leave my mark there and make mental health treatment a little bit more accessible and help somebody, even if it's just one person, if I can change their life, that would be amazing.
Oh, absolutely. And, I would add to that, Jenn, that without having your mental health in the right place, it's really hard to have your physical health in the right place. There's a lot of barriers that are created by mental health. So, Jenn, I really want to thank you for coming on today. Everybody that's listening to this, I hope that you enjoyed this conversation. If you're looking for something different, I really, I'll endorse Mediorbis and say that they are truly one of the top tier telehealth providers out there. They have proven time and again how they are different and how they're committed to solving the problem that is healthcare and helping your employees to access the care that they need when they need it at a price point that they can afford. So if you want to learn more about Mediorbis and Jenn, again, make sure that you reach out. Would love to do that introduction there. With that being said, Jenn, thank you so much for coming on today. I appreciate you so much, both as a friend and as a colleague in this industry who I know is trying to make big strides in helping people get that care that they need. So with that being said, we'll end this episode of the Next Gen podcast. Thanks for tuning in. Stop recording.